Good afternoon, my name is Samantha Zimmer and this is my art presentation. So what I decided to make for my art presentation was a collage, and I decided to use the Venn diagram format in order to better organize my thoughts regarding my personal nursing theory and philosophy. So for this Venn diagram, I used four main categories. Those categories at the top are that which you love, that which the world needs, that which you can be paid for, and that which you are good at. And I believe that as a nurse, if you're able to take your personal traits and characteristics and find where they fit in this Venn diagram, then you're able to find four other parts to your personal theory, such as passion, mission, vocation, and profession. And then when all of those things come together, in the middle, where they all overlap, is your purpose. And not only is this your purpose for your nursing profession, but also potentially for your career, the things that you're striving for and the things that you're trying to become better at. So for me, starting at the top, that which you love. So I knew early on in my nursing career that I loved babies and I loved working with women. And so it made sense for me to want to be a labor and delivery nurse. So I've always loved labor and delivery. So you've got pictures of families with new babies. This is a healthcare professional teaching a mother, how to take care of her newborn infant. And I love all parts of maternal care. I love the before, during, and after pregnancy. I think that it's just something really magical about it. So that is definitely something that I love. To this side, you find the category of that which the world needs. So on a basic level, the world needs healthcare, but at a more specific level, the world needs maternal healthcare, which is kind of where I have found my mission. So where my love and that which the world needs, I find my mission. So for me personally, my mission is to provide excellent maternal care to everybody that I can reach, whether that's in my workplace or people that I run into in the street. Eventually, I'd love to serve a out-of-state mission in maybe a third world country providing maternal care. That's really something that I would love to do. I just haven't had the opportunity to do so yet. At the bottom, you have that which you can be paid for. So I believe that if you're able to find something that you're able to provide a service to the world or your community, and you're also being paid for it, then that is going to be your vocation. You're fulfilling a need, you're being paid for it. On this far side here, you have the category of that which you are good at. So for me personally, I'm able to remember things that have happened years ago that maybe at the time seemed pointless or useless, and now I'm able to recall that information and apply it to situations that I run into. And that's actually a talent that has helped me in many different situations where I've had maybe a patient that had something going on and nobody was really able to pinpoint what that was, and I was able to recall, a small tidbit of information from nursing school years ago and able to apply that to that situation where no one had even thought about that. So in this category, I've got a pharmacological card of folic acid, which is a vitamin that is necessary for pregnant women. I thought that was appropriate for my category. So that is what I'm good at. So when I combine the things that I am good at with what I'm being paid for, that's where I find my profession. I trained for years to become a nurse, and that's something that I am being paid for. Back to the top, that which I love and that which I'm good at, where those two things overlap, you find passion. And that's what I believe I am passionate about. I love babies, I love women, I love maternal care, and I'm good at remembering things. And so when I combine those things, I'm able to be a more effective and efficient nurse because I'm able to provide excellent care to those patients. Now, when I take my passion, my mission, my vocation, and my profession, and all of those things are combined in the middle, I find my purpose. So my purpose, not only in my nursing career, but also in my life, is to be an excellent labor and delivery nurse. I love providing maternal care. That's something that I've always been interested in. I knew even before I was a registered nurse that I was going to be pursuing a labor and delivery type of position, and that's something that I have done, and through some hard work and some diligent tracking down of people, I was able to secure a position in a labor delivery field, and that's something that I'm very proud of. So my purpose is to be the best labor and delivery nurse that I can. Eventually, I'd love to pursue higher education, potentially become a nurse practitioner, and whether it be an infertility clinic helping those that are having difficulty getting pregnant, or in an OBGYN office providing care to those that are, preparing to get pregnant, those that are pregnant, and those that have recently had a child, and they need care as well. So I believe that this Venn diagram, this collage, I think it sums up quite well actually the way that I feel about my personal nursing philosophy and the things that I care about as a nurse. So I appreciate the opportunity that I've had to do this art presentation and to be able to explore the way that I feel about my personal nursing philosophy. Thank you.